Did you know that 1 in 3 of your patients have used an AI chatbot to make a health decision? 18% of them change their medications based on that advice with no connection back to their care team. That's not a future threat to how you sell, market, or build in health tech. It's already here. I'm going to show you exactly what that means for your business. 10 years ago, I was helping coordinate care for a family member across different health systems and 10 doctors. It was my husband, who's now deceased. Every single one required a different login, had a different interface, and it gave me information in a completely different format. So I spent hours just trying to make sense of what doctors were telling us. And in the middle of the night, when I couldn't reach anybody for an answer, I had to turn to Google. Today, people aren't using Google like they used to. They're opening ChatGPT, Claude, and Gemini to find answers. And they're not just reading either, they're acting. So in this video, I'm going to break down the Rock Health 2025 Consumer Adoption Survey and what they found about how patients are using AI, and what every health tech founder, CMO, and product leader needs to understand about what's happening with AI in healthcare right now without you. 32% of respondents, or 1 in 3 U.S. adults, have used an AI chatbot for health information, and that's double the rate from just a year ago, when it was 16%. 64% of people who've used AI for health questions say they're doing it every week or more often. So this is a daily habit. So what does this tell us? Patients and caregivers are using general-purpose tools as health-purpose tools before most health systems had anything to offer. The survey that I'm talking about here with these numbers was fielded in December of 2025. And that was before OpenAI launched ChatGPT Health, before Anthropic partnered with HealthTech, and before Perplexity launched Perplexity Health. So you see, the consumer demand was already pent up and waiting. Patients didn't wait for healthcare to build what they needed. They found it somewhere else. The people who are using AI for health are healthcare super users. Rock Health's analysis shows AI users have higher utilization across every care modality, virtual visits, in-person visits, and urgent care, compared to people who don't use AI. So it's not that they're avoiding the system. They're just using it more and using AI on top of it. And they're tracking their health obsessively. 43% of AI users track sleep, compared to 28% of non-users. 40% track their diet. 35% track stress. These are people who are already building their own personal health tech stacks with wearables, apps, and trackers, and AI is just the next layer. The way Rock Health describes it is that the insights are stronger, the values of tracking grows clearer, and the motivation to generate more data builds on itself. So it's a flywheel. In the webinar that I attended, Maddie Knowles flagged that this creates an emerging equity gap. Patients already generating the most data get the most value from AI, which motivates them to generate more. For teams selling into health plans or Medicaid-adjacent markets, that divergence is worth naming in your messaging. Now think about your ICP, the health systems, plans, and clinics that you're selling to. Their most engaged patients, the ones who actually show up, track their data, and want to manage their health, are already using AI without a clinical bridge. That is not a patient engagement win. That is a care coordination gap. And for your buyer, it creates real risk around outcomes, readmissions, and what they don't know is happening between visits. Now let me give you the top 3 questions that patients and caregivers are asking AI. Number 1, treatment options based on a diagnosis. That's 59% of AI users. Diagnosis based on symptoms, 56%. And information about prescription drugs and side effects, 55%. Even the lowest use category, things like insurance questions or finding providers, was still common, with nearly 1 in 3 AI users asking about those things. 41% of AI users have used AI to interpret a lab or imaging result. Not just, what does this symptom mean? No, they're taking their actual clinical documents, blood work, and radiology reports and feeding them into ChatGPT to make sense of them. There's no clinical relationship. There's no human sitting there to help contextualize what the numbers actually mean for that specific patient. And this was information that came directly on the webinar from Ashwini Nagapan, Rock Health Senior Insights Associate. Patients are using AI as a single entry point for the entire healthcare experience. Whether it's clinical questions, administrative questions, or billing questions, there's one window in ChatGPT and they are putting it all in there. So what do they do when they get an answer? 81% of AI users take at least one action following an AI chat. The most common is searching for more information elsewhere, 42%. But 40% consulted a provider after their AI, which means that AI is actually driving care visits for many users. I've seen this myself where, not ChatGPT, but Claude has told me, that's nice what you're saying about that package, that cold medicine. Make sure you check with your doctor, and that's good. 22% made or changed a healthcare appointment after an AI chat. 32% tried a new health behavior, and 18% adjusted their medications with no clinical oversight, no alert back to the care team, and no documentation anywhere. That 18% number translates to roughly 60 million Americans making unsupervised medical decisions. Think about what that means for a chronic disease management platform, or a remote monitoring solution, or a patient engagement product that's selling to a health system that's focused on outcomes. The data that your buyer cares about most, like readmissions, adherence, and outcomes, is being altered in the gap between the patient's phone and the provider's EHR. All right, so you get it. If you're a health tech founder or a CEO, a CMO, or product leader, what are you supposed to do with all this information? Glad you asked. First, understand that trust picture. AI users already trust health apps at 55%, social media at 36%, and AI chatbots at 56%, compared to non-AI users, where trusting gaps is just 25% and chatbots 15%. Users are more open to sharing health data with health tech companies than non-AI users are, 23% versus 11%. So that's a real commercial opportunity if one of you wants to build it. There's a critical distinction that came up in the Rock Health webinar after this report from Imran Qureshi, the CEO of Be Well Connected Health. He put it this way: asking a general-purpose LLM like Claude or ChatGPT or Gemini about your health is kind of like going to Reddit. It's general knowledge that you can't necessarily trust. The difference with purpose-built clinical AI, he argued, is that it can pull official guidelines, check actual patient records, and deliver answers that are specific to the patient's actual context. So the gap that your buyers are facing is not something between ChatGPT versus your tool. It's the difference between Reddit-level generic guidance and context-aware clinical guidance. So that's the positioning argument that will land well in an enterprise conversation. The challenge your buyer is about to face is where your messaging has to evolve. Rock Health flags that AI users are somewhat less willing to share their data with their own healthcare provider compared to non-users. 56% versus 71%. And that's a warning sign if people don't trust their human doctor. Patients are becoming more comfortable with tech platforms than with the formal healthcare system, and that gap will only widen if health systems keep offering clunky portals and limited chatbot options, while ChatGPT and the other tools just keep getting better and better every quarter. Your buyer is losing the patient relationship to a general purpose tool. That's the urgency hook you should use in your sales conversations. Dr. Jason Hill described it as a two-part problem when we were in the webinar: a capability gap and a trust gap. He said AI will probably exceed most doctors in raw knowledge capacity within a few years, but capability is not the barrier, and context are. He used an analogy of autonomous driving. So even if AI makes the correct decision, someone still has to bear liability for it. For health tech vendors, that means building AI that earns trust is a fundamentally different design challenge than building AI that's just technically capable of doing something. And guess what? Your buyers know this, so your sales conversations need to address it up front. Let's layer in what's happening in the funding landscape. According to Rock Health's Q1 2026 funding overview, which was published a few months ago, AI is no longer a category, it's an operating environment. Rock Health actually retired their AI deal tracking this quarter because the distinction is so blurred. AI is now table stakes, which means if your product doesn't have a clear AI strategy and your messaging doesn't reflect it, you're already behind. Obviously, the question is not whether or not to build with AI. It's whether the way you build that AI can keep patients connected to care, or AI that competes with the system. During this webinar, there was another really great analogy that was given that shapes all of this. Imran Qureshi from Be Well described a fundamental shift in the role of the physician from Oracle to Sherpa. He said, today, a lot of the job that doctors have is imparting knowledge to people. That knowledge becomes easier to get. It's now about guiding people in their journey using that knowledge. So the doctor stops being the source of all the answers and starts being the guide that helps you navigate what you've already found. Now think about what that means for your product and your users. If the physician is increasingly showing up as a Sherpa who's ready to guide, contextualize, and co-navigate, but if your patient arrives at that appointment who's still expecting an oracle to hand them everything, all the information they need, that's a mismatch. And that appointment breaks down and the patient feels unheard. The provider feels like they're starting from zero. Your platform is sitting in the middle of all that friction. The job of patient education content, onboarding flows, And in-app messaging isn't just to explain how the product works. It's to prepare the patient for a fundamentally different kind of clinical relationship, one where they bring something to the table, their own data, their AI-informed questions, and their own research, with the clinician helping them make sense of it. Companies that build for that reality will have a very different story to tell their buyers than the companies who are still designing for the patient who just shows up blank and expects you to tell them everything to do. Imran went further. He described the next horizon beyond reactive AI chatbots entirely, which is proactive AI monitoring. Not waiting for a patient to ask a question, but AI that watches patterns continuously and then reaches out when something needs attention. It's behavior change, but this is not just about information delivery per se. Behavior change is the goal. When that wave arrives, the companies that already built patient relationships around engagement and guided self-management will be positioned for it, not the ones that just serve up static PDFs and paper brochures. The consumer AI revolution has already started, and it started without us. So if your onboarding, education content, and in-app messaging are still built for the patient who shows up empty-handed and just waits for the doctor to tell them what to do, then your buyer has a problem that you haven't solved yet. The opportunity for everyone who is building and selling in health tech is this. Build AI that connects patient insight to clinical oversight, not AI that competes with the care team. Your health systems, health plans, and provider organizations are about to feel this in their outcomes data if they haven't already. They're going to need a partner that understands this shift before it hits their dashboards. Drop a comment below. Is your team already messaging around the consumer AI shift? If you want to understand why your healthcare buyers say yes or no to your platform before they even get to the demo, go watch the 3 questions that every healthcare buyer asks. I break down exactly what's going through their heads during that buying process. See you there.